Oh, how important it is to talk about this topic today. Dementia has become a ghost that haunts the golden years of millions of people worldwide. Did you know that every 3 seconds a new case is diagnosed? That's right. We're facing a global health problem affecting about 55 million people, becoming the 7th leading cause of mortality worldwide. But wait, not all is lost. Although age and genetics play their role, many cases of cognitive decline might be related to something we have in our own medicine cabinets, common medications we take daily, especially after age 60. Don't forget to subscribe to the channel to be featured in upcoming videos. Let's dive into a fascinating journey toward knowledge that can change your life and the lives of your loved ones. Longevity and well-being aren't a matter of luck, but of informed decisions. Have you ever wondered why some people maintain an active mind well into old age, while others experience accelerated decline? The answer might be in those pills we consider harmless. Throughout this journey, we'll discover which medications these are, how they affect our brain, and most importantly, which foods can act as protective shields for our brain health. Let's go, because quality of life in the senior years depends on what we do today. Medications that can accelerate cognitive decline. Let's start with first-generation antihistamines. These medications, which seem so innocent, might be playing a nasty trick on our brain health. Diphenhydramine, that active ingredient found in products like Benadryl, blocks acetylcholine, a fundamental neurotransmitter for our memory and learning. Just imagine, a study revealed that daily use for just 3 years can increase dementia risk by 54%. The first symptoms are usually that annoying brain fog, those small memory lapses we attribute to tiredness or age, like losing keys or phones. What's concerning is that many of these medications are sold without prescription, giving us a false sense of security. Are you taking any regularly? Perhaps it's time to reconsider for your well-being and healthy aging. Don't forget to like this video if you're finding this information useful. Now let's talk about benzodiazepines, those friends many seek to combat anxiety, insomnia, or muscle spasms. Valium, Ativan, Xanax, familiar names for many. These pills enhance GABA action, slowing down neuronal activity. But be careful. Consumption for more than 3 months increases the probability of developing Alzheimer's by 51%. The symptoms are subtle but revealing. Increased daytime fatigue, slow reflexes, difficulty following conversations. The problem is that many seniors use them to sleep and, without realizing it, continue taking them for years. It's as if we were slowly turning off the lights in our mind in search of rest that in the long run costs us our independence and quality of life. Do you know someone who's been taking these medications for a long time? Perhaps it's time to suggest a consultation with their doctor to explore healthier alternatives for their well-being. What a surprise we get with proton pump inhibitors. These medications like omeprazole, pantoprazole, or esomeprazole are as common as bread in our homes. We take them for heartburn or reflux. Who hasn't used them at some point? But watch out. They hinder the absorption of essential nutrients like vitamin B12 and magnesium, fundamental for brain health. B12 deficiency can cause confusion and neuronal damage, while lack of magnesium alters electrical communication between neurons. A German study with more than 73,000 elderly people showed a 44% increase in the probability of suffering from dementia. How shocking. It's not about abandoning them suddenly, but about periodically reevaluating their necessity, seeking lower doses, and combining them with non-pharmacological measures. The senior years deserve to be lived with mental fullness, don't you think? Share this video with someone who might benefit from this vital information. Antipsychotics are another group of medications that deserve our attention. Risperidone, olanzapine, quetiapine, commonly used to control agitation, hallucinations, or sudden mood changes in elderly people. These drugs modify dopamine and serotonin levels, crucial substances for motivation, pleasure, and cognitive processing. At first glance, they seem to calm the patient, but in reality, they're drastically reducing brain activity, causing apathy, and rapid decline in mental capabilities. It's no small matter. The FDA has issued severe warnings about their use in elderly people with dementia, indicating an increase in mortality. Alternatives? There are many, Music therapy, physical therapy, structured social contact, all can help gradually reduce the chemical load. Healthy aging shouldn't depend on medications that, in the long run, can worsen our brain health and compromise our independence. And what about Z-hypnotics? Zolpidem, Zaleplon, Zopiclone, those nighttime companions many turn to for sleep. These medications slow down brain activity, altering the electrical rhythms of the brain and the sequence of phases that consolidate memory. The result is poor quality rest, even though we sleep the recommended 8 hours. The British Medical Journal documented that chronic users have more falls and greater risk of dementia. What a scenario. Warning signs include episodes of sleepwalking and incoherent conversations. Alternatives to improve sleep and protect brain health? Sleep hygiene, regular schedules, dim light at dusk, light dinner, 4-7-8 breathing, valerian infusion. These are small, healthy habits that can make a big difference in our quality of life and longevity. Are you willing to try some of these natural options? Your mind will thank you. If this advice has been useful, don't forget to subscribe to our channel for more information on healthy aging. Tricyclic antidepressants, like amitriptyline or doxepin, are potent anticholinergics that block acetylcholine, that neurotransmitter so important for our memory. A study published in JAMA in 2015 showed a higher probability of dementia with higher doses and prolonged use. Initial symptoms include daytime drowsiness and difficulty concentrating, which progresses to problems with vocabulary, orientation, and autonomy. Additionally, they cause sedation that increases the risk of falls and arrhythmias, a double danger for our seniors. Despite the existence of safer alternatives, these medications remain in use because they're cheap and well-known. The problem is that the liver and kidneys of elderly people eliminate them more slowly, increasing their harmful potential. Selective serotonin reuptake inhibitors, SSRIs, exert less anticholinergic load and could be a safer alternative. The health and well-being of our seniors certainly deserve a review of their medicine cabinet. Who would have thought? Even medications to control the bladder can affect our brain health. Oxybutynin, tolterodine, solifenacin, commonly used to control overactive bladder, a frequent problem in senior years. They are potent anticholinergics that block acetylcholine, directly affecting our cognitive functions. Researchers from the University of California in San Francisco discovered that chronic users had less brain volume and worse results in memory tests. Symptoms may include forgetting appointments, difficulty organizing shopping, or confusion with the remote control. Alternatives? Of course, Kegel exercises, bladder training, pelvic floor physical therapy, all options that promote independence and well-being without compromising brain health. Isn't it wonderful to know that we can take care of our bladder without risking our mind? Quality of life in aging depends on these small but crucial decisions. Statins, those medications so often prescribed to reduce LDL cholesterol and prevent heart attacks, can also have an impact on our brain health. Atorvastatin, simvastatin, rosuvastatin, familiar names for many. Did you know that a quarter of body cholesterol is concentrated in the brain? There it serves as scaffolding for neurons and raw material for neurotransmitters like serotonin and dopamine. Excessive reduction can cause brain fog, apathy, and attention failures. Pharmacotherapy Journal reported that 75% of patients with memory complaints improved upon discontinuing the medication under medical supervision. What a revealing fact. Of course, for diabetics with atheroma plaques, statins may be essential. Alternatives include dose adjustment, spacing doses, CoQ10 supplementation, and reinforcing diet with blue fish, walnuts, and olive oil. Our brain appreciates these small changes that promote healthy aging and an active mind. Leave your comment if you know someone who takes statins and might benefit from this information. Watch out for combined anticholinergics, cold syrups with diphenhydramine and mo, decongestant anti-colic medications with scopolamine and atropine, muscle relaxants like cyclobenzaprine. The combination of small doses of acetylcholine blockers can, together, deplete the brain's deposits of this important neurotransmitter. A study with 3,434 elderly people over 10 years found 54% more cases of dementia in chronic users, even if they stopped the medications before showing symptoms. The additional problem is their omnipresence in everyday products: cough syrups, sleeping pills, gastric antispasmodics. Many patients combine several without realizing the cumulative risk to their brain health. The recommendation is to review all medications, look for names ending in amine in the package insert, and consult the pharmacist about versions with less anticholinergic load. Longevity with quality of life depends on these small but significant decisions. Brain protective foods. Let's move on to the good news. Green leafy vegetables are true treasures for our brain health. Kale, spinach, chard, collard greens, turnip greens all contain vitamin K, lutein, folates, and beta-carotenes that protect neurons against oxidative stress and optimize cerebral blood flow. What a combination. A study published in Neurology showed that consuming 1 to 2 daily servings results in cognitive performance equivalent to that of people 11 years younger. Imagine that. Who wouldn't want to rejuvenate their brain by a decade simply by including these foods in their diet? You can consume them raw in salad with extra virgin olive oil, sautéed with garlic and lemon, or in green smoothies with apple. A spinach omelet with onion and turmeric is a delicious and easy-to-prepare neuroprotective option. These small changes in our diet can make a big difference in our longevity and mental well-being. Don't forget to like this video if you're learning something new. Blue fish are another fundamental ally for keeping our brain in shape during the senior years. Salmon, sardines, mackerel, rich in omega-3 fatty acids, especially DHA, which keeps synapses flexible, favors communication between neurons, and reduces inflammation that erodes brain tissue. A true wonder for health. A meta-analysis in the Journal of Alzheimer's Disease showed that consuming fish at least once a week reduces the risk of Alzheimer's by up to 60% and can slow progression in people with mild deterioration. What hopeful news. 2 weekly servings are recommended, whether grilled, pickled, or baked, with vegetables. A practical tip: canned sardines in oil are economical, long-lasting, and maintain the omega-3 profile intact. A small change in our diet that can mean years of independence and quality of life. Healthy aging is closer than we think, don't you think? And what about blueberries? These small blue fruits are true health bombs for our brain. Their anthocyanins, that dark blue pigment, neutralize free radicals and improve neuronal signaling. Studies from the University of Cincinnati showed that elderly people who drank blueberry juice for 12 weeks remembered word lists with the agility of people 2 years younger. It's like a small time travel for our brain. Their antioxidant capacity is impressive. 100 ghrelin provide about 2,500 micromoles of ORAC antioxidant capacity, almost double that of strawberries. Additionally, they provide manganese, vitamin C, and B-complex vitamins, all essential nutrients for brain well-being. You can enjoy them with yogurt and oats, on toast with fresh cheese, or in smoothies with kefir. You can even freeze them to consume as a snack. Happiness in the senior years also comes through these small pleasures that, moreover, protect our active mind. Are you encouraged to include them in your diet? Share this video with someone who wants to take care of their brain health. Conclusion and recommendations. It's fundamental to understand that dementia doesn't appear overnight, but develops over years. Those small memory lapses we usually attribute to age, like losing keys or doubting the usual path, could be early signals we shouldn't ignore. The good news is that now we have valuable information to protect our brain health and guarantee healthy aging. Reviewing our medications with specialist doctors, seeking less aggressive alternatives or minimum effective doses, incorporating protective foods into our daily diet. These are concrete steps toward a better quality of life in the senior years. Let's not forget the importance of non-pharmacological therapies and maintaining mental stimulation activities like learning languages, solving crosswords, or playing instruments. Longevity with well-being is in our hands. Knowledge is power. And now you have the power to protect your mind and your independence for the years to come. Has this information been useful to you? I hope so. Remember that taking care of our brain health is an investment in our future quality of life. The medications we take today can have a significant impact on our cognitive health tomorrow. But we also have at our disposal protective foods that act as shields for our brain. The combination of a conscious review of our medicine cabinet and a diet rich in green leafy vegetables, bluefish, and blueberries can make the difference between aging with limitations or a full and independent senior life. It's never too late to start taking care of our mind. Happiness in the golden years largely depends on the decisions we make today. Are you ready to take the first step toward healthy aging? Your brain will thank you. ¿Cuál de estos consejos te parece más útil para tu vida? Déjanos tu opinión en los comentarios y comparte este video con alguien que también quiera vivir una vida larga y saludable. No olvides suscribirte y activar las notificaciones para no perderte nuestros próximos videos llenos de consejos prácticos para tu bienestar. Hasta la próxima. Soy Dr. John. Y recuerda, nunca es tarde para empezar a vivir mejor.